Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of June 21st, 2023. This week, I'm going to complete the question that we asked a couple of weeks ago, which is how important is it to take care of my teeth? You'll recall that we had three conclusions. One was that poor oral health can cause significant health problems directly, indirectly, and socially. And if you didn't see the update on June 8th, please look at that before watching this one. The second conclusion is oral health can be maintained by regular care, access to fluoridated water, periodic visits to an oral health professional, ideally starting at a young age. And third, as a nation, we have to address the fact that many people can't access dental care. Well, this week, we're going to pick up on the second question and ask the question, what do we really know about how we can maintain our oral health? Well, according to the American Dental Association, and these are all evidence-based conclusions, that we should brush our teeth twice a day with fluoride toothpaste for 2 minutes. Each part of this is important. I did see some reports suggesting that once a day is adequate, but I think the data support twice a day. Fluoride toothpaste, certainly, in 2 minutes. Again, I saw a report that suggested 10 minutes. I'm not sure I could convince many people to do that. So brush your teeth twice a day with a fluoride toothpaste for 2 minutes. Clean between your teeth daily, obviously either flossing or with some sort of pressured water. I find both these pictures sort of disturbing. I'm not sure how many people smile when they're doing this, but the one on the left is particularly disturbing because there's somebody watching her do it. But nonetheless, you're supposed to clean between your teeth every day. Eat a healthy diet that limits sugary beverages and snacks. I think sugar-sweetened beverages are one of the significant health challenges that we face as a nation. And then the ADA suggests see your dentist regularly for prevention and treatment. I'm always a little skeptical of these kinds of recommendations, but in this case, there is in fact data that support visiting a dentist regularly. They go on to recommend consuming fluoridated water. The CDC has very strong evidence in favor of this. I'm not going to go over this infographic. If you want to pause the video and look at the data that the CDC reports on the importance of water fluoridation. Refraining from the use of tobacco products. Tobacco use is very much associated with tooth loss. Again, as we talked about last time, it could be because there are common factors that lead to both, but it could also be direct impact. The ADA is against oral piercings and at-home orthodontic treatments. I'll let you all look that up. But the CDC independently recommends the use of sealants. That's where material is painted onto the back teeth of children and significantly reduces cavities in those kids. So poor oral health can cause significant health problems. Oral health can be maintained. But this leads to the last discussion, which is we have to figure out a way to get more Americans access to not just health care, which remains important as we've talked about before, but especially dental care. So as what I said last time, a significant number of people are worried that their oral health, appearance of their teeth impacts their ability to get a job. But also it turns out that in addition to all the health issues we talked about last time, there's very significant social issues. We tend to judge people on the appearance of their smile, both as adolescents and as adults. And as we talked about last time, if you look at this person and compare her to that person, of course, it's the same person. The only thing that's changed is the quality of their appearance of their smile. And you do realize how much we tend to judge people on their physical appearance. And despite all of the evidence of the importance of dental health, about a third of Americans did not visit the dentist in the last year, and 1/5 of Americans admit to never or rarely seeing a dentist. It's 3 times more likely in poor Americans. And it's estimated that 74 million Americans don't have insurance that covers dental care. And has been reported and said elsewhere, dental care is the #1 medical service that Americans skip because of cost. According to the Kaiser Family Foundation, nearly half the people on Medicare have no dental coverage. And therefore nearly half of them and almost 2/3 of Black beneficiaries did not see the dentist in the past year. And there's a lot on this chart of importance, You can see that 47% of Medicare beneficiaries did not see a dentist. It varies by race. But if you go down here and look at income, the poorest group, 3/4 of them did not see the dentist in the past year compared to 1/4 of the wealthy ones. So dental care has become something of a luxury for wealthy Americans. Of those who did access dental services, 1 in 5 spent over $1,000 and the average was $450. And if you think about it, a lot of poor Americans simply don't have $1,000. And this is the breakout. You can see that about a third of the Medicare beneficiaries who did see a dentist spent more than $500, and 1 in 5 spent over $1,000. So the cost of dental care is a tremendous disincentive to getting it, despite the fact that it's important for health reasons as well. So poor oral health can cause significant problems. We can improve our oral health, but we've got to figure out a way of getting people access to it. Please feel free to share these videos with anyone who might be interested or add them to our listserv. As always, the data that I present, I'm solely responsible for its content. The videos themselves are produced, edited, and captioned and posted by Dara Young. If you have any comments on this issue or any other evolving public health issue, please let me know. Until next week, I look forward to hearing from you, and be well.